Thank you for agreeing to this interview. Do you mind if I record you throughout
Not
the
a
process?
problem.
Okay, thank you. So to start off, what do you like and what do you dislike about your career?
Being honest, I like the pay.
Yeah.
I like being able to help people out in times, I guess, where they need it the most. Usually people that are having surgery typically need it for a certain reason. What else? Those are probably the two biggest things.
Any dislikes, really?
Sometimes you have to deal with people who aren't always the nicest or in the best mood. But you kind of just have to bite your tongue and just kind of do your job and focus on what you need to do. That's probably the worst part. I mean, things can get stressful at times too. Obviously, there's certain cases or certain traumas that can come in where the outcome's not always good or people don't make it. So that's probably the worst part.
Okay. How difficult would you say that the RN program in medical school was for you?
The RN program compared to the nurse anesthetist program was a lot easier.
Really?
Yeah. The RN program was kind of just starting to understand the medical field and certain things that had to do with nursing, where the nurse anesthesia program was more medical and had to do with a lot more scientific and more biological things that had to do with the body at the cellular level. So those are probably the biggest differences, but anesthesia school is a lot harder than nursing school by far.
Yeah.
Yeah.
Okay. How many years is RN and specialized?
So typically an RN program, if you do the bachelor route, is 4 years.
Okay.
If you do an ADN route, which is the junior college level, that's 2 years. And then I think you can go back for another year and a half to 2 years to get your bachelor's, but just part-time. My program is a little different because I got my original bachelor's in kinesiology, and then I went back, and there's certain programs that do for people who already have bachelor's degrees, they do like an accelerated program. So mine was actually a bachelor's to master's program. So the first bachelor's program, or the first part of the program was 15 months. So it was like an accelerated bachelor's. And then I did another 15 months after that. It actually ended up with my master's. So I never got my bachelor's in nursing technically. I just got my master's in nursing because I already had a bachelor's in a different field. So my route was a little different, but the typical bachelor's program is 4 years for nursing.
Okay.
And then anesthesia school is another 2 years full time.
Okay.
But some programs are also 3 years because now they're going to make it doctor level. So you actually end up with your doctorate degree instead of your master's. So that's why they're doing it 3 years.
So you basically become like a nurse, but you have a
You're
doctorate.
a nurse with a doctorate, yeah. So you have it's called there's different ones, but like a DPN, Doctor of Practice in Nursing, or you can have like a DNP. There's a couple different things, but you end up with your doctorate.
Okay.
Yeah.
So you have the education of a doctor, but you work as...
In a way, that's kind of debatable between doctors and people like nursing that become doctors. Definitely medical school is more theoretical, and a lot of physics and biology, where nursing they don't have to really do all that. So it's just different. It depends who you talk to, and so there's a lot of debate in that field, but yeah. So technically you do get your doctorate.
How old were you when you first started your career?
In anesthesia?
Yeah.
Where was I? 2016. I was about 29. I think 29, right before I turned 30, I think.
Okay.
Yeah.
Do you know what the demand or competition is like for your type of profession?
High, very high, especially in California. A lot of nurse anesthetists want to work in California because either they're from here and because the pay is really good. Cost of living is obviously more expensive too. That kind of has something to do with it. But even around the whole country, nurse anesthesia is very competitive.
Do you know what your salary is, like your net gross versus?
Yeah, well, for me, I have a couple different jobs, but with anesthesia, you're kind of able to do different things. Like I have a private practice job, and I have my full-time job, and then I do another job on the side too. So just my one job, I think at my level, I'm about 200,000. Other people that have more experience are probably like 240, 250. But with the other side jobs that I do, I probably bring like 280. So,
Oh wow.
but that's like private practice where you do like plastic surgery centers, or there's like pain clinics. There's a lot of different stuff you can do on the side that isn't in the hospital. So.
Okay. One thing I've always just wanted to ask is, how much do you actually learn through college and the programs versus actual experience, would you say?
Like in the actual anesthesia program?
Like when you actually like begin to work, like how much do you actually learn by just working versus what you're taught?
Your first year you learn a ton on your own, because when you're in school, you're usually with someone, always in the OR when you're training. Once you're on your own and you're in there like by yourself and you're making all the decisions on your own, that's when you really kind of learn your first year, like how you want to practice and what you're going to do. Kind of not necessarily experiment, because you don't want to experiment on patients, but doing stuff safely that you know you can do, just to kind of better make yourself, because there isn't just one way to do anesthesia. There's multiple ways, there's multiple medications people can give, so kind of perfect it on your own.
What was the hardest type of thing for you to learn through college? Was it like pharmacology, microbiology?
For me, chemistry. I don't like chemistry stuff very much, and probably physics. Pharmacology, I actually really like. That kind of came easy to me, even though it has to do with chemistry in a way. It was just kind of easy for me. Anatomy was cool. Physiology is pretty cool. But for like anesthesia, like applied, it's like apply anesthesia and apply the physiology part with anesthesia, I liked a lot.
Interesting.
So I didn't like it, but yeah, chemistry just doesn't do it for me.
Yeah. How often do you see patients?
So every day, because you always see a patient before you take them back to the OR. You see the patient when they're waking up, although they're not fully with it. I mean, you're there.
Yeah.
Obviously, you're with them the whole time, but they're still asleep. You'll see patients' families before you bring back to the OR. But in like labor and delivery, I mean, if you have to go put an epidural, do a C-section, you're with the patient that whole, whether it's the procedure of the epidural or that whole C-section, because they're awake. So, so different, depends where you're working for the day and what you're doing, really. Kind of different levels of seeing the patient.
What kind of liability do you have as a CRNA?
Yeah, so the hospital covers our liability here. I do some private practice though, and I only do, let's see, what did I tell? I think I do less than 1,000 hours a year. So my liability, I have a 1 to 3 million liability insurance. I spend not too bad as of now, because when you're newer you don't need as much, but it's like $2,000 a year.
Okay. Personal question: how much student debt do you think that you have accumulated throughout every program and all that?
Like 180,000. Yeah. Not everyone does that, obviously, because some people do their undergrad at state schools or junior college, and they don't have to take any student loans out. Some people's parents are lucky enough to pay for all their education. Like I had a scholarship for baseball for my undergrad, so I didn't have any loans. But then when I went back for nursing and then anesthesia, I had to take out loans. So, and I went to private school.
Oh wow!
So it kind of just depends. But some people get away with nothing. Some will have 50. Some will have more than 200. So it really just depends on the program you go to. Different anesthesia schools have different costs too. So.
What made you interested in this type of profession?
When I was 13, I had surgery, and a nurse anesthetist did my anesthesia as well, and that's kind of what first sparked it. But then after that, I always thought about it, but I never thought I was ever going to do it. And then I was 21, I had another surgery, and a nurse anesthetist as well. And my dad, who works in the hospital, actually was always telling me about nurse anesthesia. And so I thought I was going to go to physical therapy school after I graduated, but then something just changed, and I ended up deciding to pursue it. But I never wanted to just become a nurse. I said it to myself, if I did it, I want to do nurse anesthesia for sure, not just basic nursing, because I mean, nursing's cool, but I wanted to do more.
Okay.
So.
What's your schedule like with hours? Does it change or is it constant?
So different. It really depends on the hospital you're at. My current hospital, I only do 16-hour shifts and 24-hour shifts.
Mm-hmm.
Other people will do only 8 hours. Some will do a mixture of 8 hours and 10 hours. But other hospitals, some don't allow 16 or 24-hour shifts, so they may only do 10s and 12s. So it really just depends on your department and what schedule really they work.
Okay.
And what they do.
About how many years of schooling do you think it took you total to finish?
Including undergrad and everything?
Yeah.
Including my previous degree?
Mm-hmm.
Well, since I did it a little bit different, so it took me for about 9 years in total. Other people, it really only take probably 7 years to do. Mm-hmm. Like if you just went straight into nursing anesthesia. Mm-hmm. But with nursing anesthesia, you have to have a certain amount of years of ICU experience as a nurse, so you kind of have to include that too. So I did 3 years of ICU experience before I could even apply to anesthesia school, so that kind of takes it a little bit longer.
Mm-hmm. Could you tell me about like an average day for you? Like what kind of things that you do during like a single day?
Yeah, so if I'm in the OR, I get to work at 6:45.
Okay.
I look at what room I'm in, then I start looking at my cases and see what I have to do for the day. Mm-hmm. I'll look up the patient, look at their medical history, see what they have going on, see what, basically just start assessing like my plan, making what I want to do, what I'm going to do, what I'm not going to do. Start preparing all my medications, start preparing my equipment. Once all of that is done, then I'll go see the patient. Talk to the patient, talk to them about the plan, ask them what they're having done, ask them about their medical history and things like that. Assess which medications they're on, what medications they took this morning, because that can affect a lot of different things with anesthesia. After that, basically we'll take them back to the room, or usually in the room starting at 7:30. And then the rest of the day is just kind of seeing the next case and looking for it. And once I'm done with that case, go to the room, prepare for the next case, go see the patient, just kind of keep going and going.
Do you, are you called in for like surgeries, like applying anesthesia through surgeries?
That's what I'm talking about.
Okay.
Yeah, so as a nurse anesthetist, different states have it different, but in California we can practice on our own. We don't have to have an anesthesiologist there. There's a lot of hospitals that are ran by nurse anesthetists only. There's not one anesthesiologist in the hospital. So yeah, we can practice independently. A lot of the times we won't even see an anesthesiologist the whole day.
Oh, wow.
Kaiser is we call it a collaborative practice. So we all kind of work together just to make things move faster. If we ever needed something, we can always call another nurse anesthetist or an anesthesiologist to come help out, but a lot of the day we won't see like an anesthesiologist or anything. So you go to school to be able to practice on your own, because different states you're going to be by yourself. You won't be with an anesthesiologist or vice versa.
So if I wanted to move states as a nurse anesthetist, would some states allow me to be dependent upon someone higher than me?
So some states you'd have to practice in a facility that there's an anesthesiologist. As of now, I can't remember the exact number, but I think we're just over 30 states where nurse anesthetists can practice on their own without an anesthesiologist in the hospital or in any facility.
Do you know what the difference between an anesthesiologist and a CRNA is?
The biggest difference, obviously, is that an anesthesiologist went to medical school. Yeah. So they have, their license, their medical license, where a nurse anesthetist doesn't. They have probably a little more foundation in the different sciences like physics, because not every anesthesiology prerequisite needs you to have physics and stuff like that. They do a little more research as well in undergrad school compared to nurses. I mean, nurses do research as well, but just different programs are different. But as far as the anesthesia training itself, it's pretty much the same. They do more specialty training, like in cardiac surgery or like regional anesthesia, where they can study that a little bit further compared to CRNAs. But in other states, CRNAs can still do hearts and stuff like that.
Okay.
But as far as the actual training itself, it's pretty much the same.
Okay. Are you on call like doctors are?
Yeah, so we have 2 calls a month.
Mm-hmm.
It's usually just an 8-hour call shift.
Mm-hmm.
But it's actually at our hospital, only the CRNAs are on call. The anesthesiologists aren't on call.
Oh, really?
Yeah.
Oh, wow.
And then there's always 2 anesthesiologists in the hospital. There's 1 in the OR and 1 in labor and delivery. And then there's 3 CRNAs in the hospital. There's 1 in labor and delivery, 1 in the OR, and then 1 that can float between both floors if we needed to.
Okay. How often would you say that you have to cooperate like with other people in order to perform your normal job?
So you have to cooperate. I mean, not really cooperate. It's just, you work along the nurses, the OR nurse, the surgical techs, obviously the surgeons, and then anesthesia and the anesthesiologist if they're in the room, or if you needed their help. So once you start working at a place long enough, you know certain people, you know how they act, you know just kind of what you're getting yourself in for the day. But everyone they should work pretty well with each other every day. So.
Can you tell me about one of the most challenging experiences that you've ever had?
Like with a certain case, or
just anything? Yeah, probably a certain case.
I guess certain traumas that come in because you don't know, you don't have time to know medical history, you don't know what the patient's been taking or what they're on, because they have to pretty much go straight to the OR or they're going to die. So those are always challenging because you just don't know what you're working with or what you're trying to fight against. And everyone's kind of stressed out. The surgeon's stressed with their stuff, anesthesia's stressed with our stuff. So those are probably the things you remember the most. And sometimes you do have personalities in the OR, whether it be a surgeon or whatnot, that you have to deal with. That can be difficult at times too, that everyone kind of gets uncomfortable around, but you kind of just learn to deal with it and do your job and do what you need to do for the patient.
How easy or how difficult would you say memorization of different types of medicines or anesthesias would you say that there are?
It can be hard to remember. Everyone always says the smartest you are is right after you finish school and preparing for boards, because you're trying to just remember everything. And after that, you're kind of just like, oh, whatever, you forget a lot. But, the stuff you do every day and you use every day, you have to know what it is. It's not that hard memorizing it, especially when you're doing it every single day. There's certain medical conditions that you still have to look up that are rare to kind of remind yourself, because there's just no way you can remember every little thing, because some stuff's so rare. But the majority of main diseases and main medications, you're going to always remember that. There are new medications that you'll have to look up to because everyone has to, the learning never stops. You still have to kind of re-educate and relearn. You have to go to certain conferences every year and stuff to and do education units to keep your license. So you're always kind of still studying in a way. So.
How long have you been working this profession for?
3 years now.
How do you like it?
It's great. Yeah, it's awesome. Probably one of the best jobs. I think that in 2018 is ranked number 2 or 3 best jobs to have in the country.
Really?
Yeah. So it's a good job, good career. I think it's still kind of not many people know what a nurse anesthetist is or have ever even heard of it. And I think a lot of people that get anesthesia think that they're getting anesthesia through an anesthesiologist, but it's actually a nurse anesthetist, especially through Kaiser and some of the university systems. So.
Yeah, I've done research about the demand and the pay, and it's kind of more of a not so heard kind of thing. And would you say that over the next 10 years that it's definitely going to be in a way higher demand? I
think so. I think with the way healthcare is continuing to go and demand of people needing healthcare, there's just not enough people or doctors or anesthesiologists, and they're going to rely even more and more on advanced practice nurses like nurse anesthetists and nurse practitioners and nurse midwives, things like that. So I think there's always going to be a need, but I think it'll keep getting higher and higher for sure.
Would you say that the demand for doctors will decrease?
I don't think so, because there's always going to be people going to medical school. There's always going to be people who want to be a doctor. I don't think that will decrease. I just think the demand will increase for more providers. I don't think there are enough doctors or enough nurse practitioners, stuff like that. So I think the demand will actually just keep going up and up.
So you're saying that basically the healthcare is basically a secure job, and it will always be a secure job because the demand will always be
Yeah,
increased.
the healthcare is always going to be. There's not a robot that's going to be able to do. Although they have different robots that can like push medicine and stuff like that, or can kind of control things. There's never going to be a healthcare system that can be run on a robot. So you're always going to have. There's always going to be a job for healthcare.
Okay.
I think healthcare is probably the most secure job there is, compared to anything else, compared to business and stuff like that.
Okay. Well, and that's all the questions
Is
that I
that
have
it,
for you.
man?
Yes,
Oh,
it
man,
is.
you should get an A.
Thank you so much, Mr. Goins. I really appreciate it.
Yeah, man. Good job.